Group homes for people with developmental disabilities are also of high concern for the spread of the virus. So far, 2 people in these homes have died in Rhode Island. Eyewitness News reporter Steph Machado spoke to the state about how they're trying to stop the spread in these homes.
There are now dozens of cases of COVID-19 in group homes for people with developmental disabilities, and the state's now looking for more workers to help.
None of this work is simple or easy.
Carrie Zanke with the Rhode Island Department of Behavioral Health Care, Developmental Disabilities and Hospitals, or BHDDH, says there are 59 residents who have tested positive for COVID-19 in 21 of the state's licensed group homes for people with developmental disabilities and 5 homes for behavioral health care. That includes Cranston-based Access Point RI, which Zanke says has cases in 4 of the agency's homes. Access Point says 14 of their residents have now tested positive for the virus, and 2 have sadly died, including the state's youngest death so far, a woman in her 20s.
Early on, it's very clear that they had staff who were probably working in several locations due to some of the staffing challenges, and likely that the contact tracing efforts, that likely was the source of the spread.
Zanke, who actually stepped down as director of the Division of Developmental Disabilities last week but stayed on to help with the crisis, says Access Point did not do anything wrong at the time. But now BHDDH is advising group homes to stop having workers move between different homes.
I can imagine that there are staff that probably do need to work in multiple locations due to the urgency and the need for staffing. But with that comes close screening by our agencies, and we are not having staff that have had an exposure in one home go to a home that hasn't had exposure.
Access Point's executive director Thomas Kane tells me staff members who work with residents who have tested positive are restricted to working with positive residents. And Zanke says when direct care workers test positive, they are staying home, leaving a shortage of staff. And Zanke urges anyone who can volunteer to work in these group homes to go to the new RI Responds website. We will link to that on WPRI.com. I'm Steph Machado, Eyewitness News.